bacterial pneumonia is an inflammation of the lungs due to bacterial infection. Different types of bacteria can cause pneumonia, and pneumonia can occur in both lungs, one lung, or one section of a lung. The different bacteria that cause bacterial pneumonia are Streptococcus, which is the most common type of bacteria that causes bacterial pneumonia. And it is shaped very differently than some of the other strains. Then we have Mycoplasma pneumoniae, and that is shaped kind of like this. And then we have Staphylococcus aureus, and that is a bunch of little bubbles under the microscope. Kind of look like that. And then we have this interesting little guy, Legionella pneumophilia. This little guy has a tail, so he swims around in those lungs. And he's called Legionella pneumophilia. Then we have Chlamydia pneumoniae. And these little guys look kind of like this. And last but not least, we have Haemophilus influenza. And these guys look like this under a microscope. So they have the different types of bacteria that cause pneumonia. And let's see. A little bit about bacterial pneumonia. Typical symptoms include chest pain, shortness of breath, a cough that may produce yellow or green mucus, fever, tiredness, and chills. Symptoms of bacterial pneumonia tend to be similar to both children and adults. Complications may include the following: respiratory distress or failure. This might develop if oxygen levels in the lungs drop too low or if carbon dioxide levels spike. It can occur due to inadequate breathing ability, and respiratory failure may even cause lung function to stop completely. Sepsis occurs when the infection causes an overwhelming inflammatory response throughout the whole body. Sepsis can lead to failure in multiple organs and may be life-threatening. Lung abscesses occur when an infected pocket of pus forms in the lung. An empyema is an infectious collection of pus in the pleural cavity and that surrounds the outside of the lungs. Swift treatment is very vital for reducing the risk of complications. The cause of bacterial pneumonia is small air sacs called alveoli are within the lobes of each lung. Normally, these air sacs aid in the body's gas exchange while inhaling oxygen and exhaling carbon dioxide. When a person develops pneumonia, the air sacs experience inflammation, which can cause them to fill with fluid. If the air sacs fill with fluid rather than air, breathing might become difficult. In some cases, the lungs and the rest of the body may not get enough oxygen. The treatment for bacterial pneumonia includes antibiotics, which target the specific types of bacterium that cause the infection, which were the bacterium that we talked about here. A doctor might also prescribe medications to ease breathing. Additional medications may include over-the-counter drugs to ease aches and pains, as well as reducing fever. Some bacterial pneumonia can develop as a complication of the flu, so getting the annual flu shot may prevent pneumonia. 2 different pneumococcal vaccinations are also available for reducing a person's risk of developing bacterial pneumonia. Doctors recommend that children should receive a series of this PCV13 vaccination starting at 2 months of age. And that is bacterial pneumonia.